Hello, my name is Chloe Thomas. I am enrolled at Chattahoochee Technical College. This is course number 1105, and the date is July 12th, 2026. In this video, I will be discussing the topic of safety with references from the Cengage book titled Health, Safety, and Nutrition for the Young Child by Lynn R. Moratz. The specific topic I will be discussing will be safety in the classroom. In chapter A2C of the textbook, it states that active supervision is beyond question one of the most important roles families and teachers can have. From my own personal experience, I have learned just how important it is to actively supervise the children in the classroom. Young children are at the most risk for making unsafe choices, whether it's climbing on a table or a shelf, or even getting upset with a friend when choosing to hurt them. Actively supervising the children in the classroom helps them be able to gauge the actions of the children and intervene when necessary to keep the children safe. Chapter 8.2d of the Cengage textbook states that the earlier the children learn about safety, the more naturally they will develop the attitudes and respect that lead to safe behavior practices. Children can be taught about safety as early as a few months to a few years old, and in the classroom, I always strive for teachable safety moments. If a child is wanting to make an unsafe choice, I like to show them how to make it a safe choice, and I reward them with praise and encouragement, along with redirecting them onto something different that they can do that is much, much safer. Implementing and maintaining safety practices is a lot of what teachers should be doing. Chapter 8.3 states that safety must also be a continuous concern. Whenever we bring in new toys, we have to factor in how safe it is for the children. For example, if there are holes in the toy, can the child's finger get stuck, or could they even possibly choke on it? And even when rearranging the classroom, we have to think ahead about whether or not the child might want to climb on something in order to get to something else. Like if they climb on a table to get to a window or a countertop, we have to prevent that. And we also have to make sure our lesson planning is age appropriate. For example, giving a 1-year-old scissors for a craft would be inappropriate and unsafe. But an older 3-year-old could use the scissors with appropriate supervision. And in conclusion, active supervision, early safety teaching, and maintaining safety practices are some of the best ways to keep the classroom safe. As an early childhood education teacher, it is one of my main goals to keep my classroom safe. I use my best judgment, thinking ahead of the children and keeping it a positive space where the children learn how to be safe age appropriately.